Hey guys, my name is Greg Inegbe, and I'm here to talk to you about BMI, that is called Body Mass Index. This is my lovely partner here, Christopher Royster. And today we're going to assess his body mass index. The first thing we're going to do is assess his height and weight. But if you could please, I would ask my patient to please remove everything from his pockets and have his shoes off like he has right now. Then I'll ask him to step on this scale. And we would get the weight. We're going to do this in pounds. It's important to make sure that you have the scale leveled. And he currently weighs 172 pounds. So then I'll ask my patient to step off, turn around, and face the skeleton in front of you. And if you can step at the scale, back on the scale, have your shoulders completely back, and have your feet a little bit, and take a big deep breath, and step off. And he's currently 5'9" and a quarter. So the way we document BMI is that we take that weight in pounds and divide it by the height in inches, and we square that number and times it by 703. There are 4 classifications of weight status: underweight, normal, overweight, and obese. Our patient was classified as 25.2, and that is overweight. Another way we can do this is also in kilograms or meters. The formula is listed above. Basically, we perform this test to get a simple, non-invasive, and it's a very inexpensive way of measuring body fat. Studies have shown that a high BMI can lead to future morbidity or even death or even some complications in their health. It's very important to know that a contraindication of BMI is that it does not measure body fat directly at all. Also, muscle mass, age, and other factors can play a role in increasing your BMI, but that does not necessarily mean that you're at risk for certain health complications that may be seen with a obese patient or maybe an overweight patient. So here are some key things to remember when you're assessing BMI. When you're assessing the patient's weight, always have them take off their shoes and remove all belongings from their pockets. When you're assessing their height, make sure they always stand up straight, and that means females and males, no hair buns. And also know that formula. That formula is going to be very important in calculating the BMI. And also, additional tests may be needed for some patients because, as you can see from my patient, he did not look like he was overweight, but a simple test, skin fold thickness test, could test his body fat, an evaluation of his diet, or maybe his family history or his medical history. And it's also very, very, very important to remember that BMI is not a direct measurement of body fat, so do not get that mixed up. And here are my resources that I used for this presentation.